Welcome. Have you ever experienced a tingling sensation, numbness, or pain shooting down your arm or leg? You might be experiencing an entrapment neuropathy. In this video, we'll explore these conditions, diving into what they are, what causes them, how they're diagnosed, and what can be done about them. Let's unravel the mystery of entrapment neuropathies. Entrapment neuropathies occur when a nerve gets compressed or squeezed, often as it passes through a narrow anatomical space. Think of it like a garden hose getting pinched, the water flow, or in this case, nerve signal, is disrupted. Several factors can contribute to this compression. Repetitive motions, like typing or assembly line work, can lead to inflammation and swelling around the nerve. Trauma, such as a fracture or dislocation, can directly compress or damage the nerve. Other conditions, like arthritis, diabetes, and even pregnancy, can also increase the risk of nerve entrapment. Sometimes there's no identifiable cause, and it's just chalked up to anatomical variations. Okay, so how does this compression lead to symptoms? When a nerve is squeezed, it disrupts the normal flow of electrical signals along the nerve fibers. Initially, this can lead to irritation and increased sensitivity, causing tingling or pain. As the compression continues, the nerve's ability to transmit signals effectively decreases. This can result in numbness, weakness, and even muscle atrophy in the areas supplied by that nerve. The severity of symptoms depends on the degree and duration of the compression. Prolonged compression can lead to permanent nerve damage. Entrapment neuropathies are fairly common, affecting a significant portion of the population. Carpal tunnel syndrome, one of the most well-known entrapment neuropathies, alone affects millions of people each year. Certain professions that involve repetitive motions or awkward postures have a higher incidence. Similarly, individuals with pre-existing conditions like diabetes are at greater risk. Age also plays a role, as tissues tend to lose elasticity and become more prone to inflammation with age. The symptoms of entrapment neuropathies can vary depending on the specific nerve involved and the severity of the compression. Common symptoms include pain, which may be sharp, burning, or etching. Numbness or tingling sensations, often described as pins and needles, are also frequently experienced. Weakness in the muscles controlled by the nerve is another telltale sign, sometimes leading to difficulty with fine motor skills, like buttoning a shirt. In severe cases, muscle atrophy or wasting can occur, indicating significant nerve damage. These symptoms often worsen with specific activities or positions that aggravate the nerve compression. Diagnosing entrapment neuropathies typically involves a thorough physical examination and a review of the patient's medical history. The doctor will assess sensation strength and reflexes in the affected area. Specific provocative tests, which involve maneuvers designed to reproduce the symptoms, can help pinpoint the affected nerve. Nerve conduction studies and electromyography, or EMG, are often used to confirm the diagnosis. These tests measure the speed and strength of electrical signals traveling along the nerves and muscles, helping to identify areas of nerve compression or damage. Imaging studies, like MRI or ultrasound, may be used to visualize the nerve and surrounding tissues and rule out other potential causes of the symptoms. Entrapment neuropathies are classified according to the specific nerve that's affected. Carpal tunnel syndrome, affecting the median nerve in the wrist, is a prime example. Ulnar nerve entrapment at the elbow, also known as cubital tunnel syndrome, is another common type. Peroneal nerve entrapment at the knee can cause foot drop. Thoracic outlet syndrome involves compression of nerves and blood vessels in the space between the collarbone and the first rib. Sciatic nerve entrapment, often called piriformis syndrome, occurs when the sciatic nerve is compressed by the piriformis muscle in the buttock. Each type presents with distinct symptoms and requires targeted treatment. Treatment for entrapment neuropathies aims to relieve pressure on the nerve and reduce inflammation. Conservative measures, such as rest, activity modification, and splinting, are often the first line of defense. Physical therapy can help improve range of motion, strengthen muscles, and teach proper body mechanics. Over-the-counter pain relievers like ibuprofen or naproxen can help manage pain and inflammation. In more severe cases, corticosteroid injections may be used to reduce inflammation around the nerve. If conservative treatments fail, surgery may be necessary to release the compressed nerve. The specific surgical approach depends on the nerve involved and the location of the compression. Preventing entrapment neuropathies involves minimizing risk factors and adopting healthy habits. Maintaining good posture and ergonomics, especially during repetitive tasks, can reduce strain on the nerves. Taking frequent breaks to stretch and move around can prevent stiffness and inflammation. Avoiding prolonged pressure on nerves, like leaning on your elbows for extended periods, is also important. Controlling underlying medical conditions, such as diabetes, can help reduce the risk of nerve damage. and maintaining a healthy weight can reduce pressure on joints and nerves. The prognosis for entrapment neuropathies varies depending on the severity of the condition and the timeliness of treatment. With early diagnosis and appropriate management, many people experience significant improvement and return to normal function. However, if nerve compression is prolonged or severe, permanent nerve damage may occur, leading to chronic pain, weakness, or numbness. Recent research is focusing on developing new therapies to promote nerve regeneration and reduce inflammation. For example, studies are investigating the use of platelet-rich plasma, or PRP, injections to promote nerve healing. Advances in surgical techniques are also improving outcomes for patients with severe entrapment neuropathies. Thank you for watching, and we hope you learned something new.